Welcome back to Rural Health Summit, a season of Rural Health Today. In this season, we're sitting down with a series of guests at the MHA Annual Summit meeting, where many healthcare executives and leaders across the state meet to review the last year of collaborative efforts and the work that we've accomplished. In each episode, I'll ask my guests to give us an update on their hospital or healthcare organization and to touch base, so to speak, on the healthcare issues they see that is most pressing in their corner of the rural health world. Welcome to another episode of our Summit series. Today we're talking with Tom Kurtz, president of Memorial Healthcare. And I want you to talk a little bit about Memorial. Someone might be listening to this in Nevada going, what is that? Is it a memorial to somebody? What is it? Well, it's a hospital system. You guys are doing a great job. You've made a lot of news in your area because you're not conventional rural hospital. You're a full continuum care hospital and doing even more than that. So, Tom, give our listeners a little sense of who you are and what system, what type of system are you?
Yeah, I'm happy to be here. So Memorial Healthcare has been in existence since 1921. And since that, really the creation of that system, it's been a community-led effort.
Yeah.
We're a community-based hospital located in Owasso. Our service area covers roughly 6 counties of our expanded services through our employed medical group. Throughout our 104-year service to our community, have remained an independent community hospital.
Yeah. Here.
Exactly. Focused on delivering the care needs that our community is looking for.
Yeah.
And so through that history, we've had a number of amazing years, some challenging years, but have remained close and true to that mission of meeting the care needs of our community through that history.
So I would assume a big celebration's coming up here in a few years then for you, and you're over 105 years old. Is that what it's going to be?
Yeah, we actually had a really great 100th anniversary.
Did you?
Right in the middle of COVID.
Isn't that great?
It was great.
Yeah.
So we had a nice outdoor celebration of 100 years of service to our community. But we're very proud of that history.
Yeah. Always been independent.
Always been independent.
Never city-owned, never operated, always independent.
Right from the initial community gathering about wanting to honor those coming back from World War I. That's the name Memorial Healthcare.
There you go.
Been that community effort ever since the conversation started back in the teens, and that building was constructed in 1921 and been consistently providing care to our community since then.
How long have you been leading the organization?
Since January. So
January.
Very
Is that
short
right?
period of time.
Okay.
Yeah, I've been at Memorial for 10 years now.
Yeah.
In various roles. I actually came into the organization as Chief Information Officer, traversed through some roles in Chief Administrative Officer, Chief Operating Officer most recently, and since January, I am now the CEO of Memorial Healthcare. Now, we have multiple brands.
So explain that.
Yeah, absolutely. We were... For the first time in 104 years, our corporate structure has changed. So we, in early last year, established the Memorial Health System. And that is a very strategic approach for us to continue to be successful over the next 100 years. Yeah. It allows us to continue to diversify our organization in many areas that are related to healthcare, but not necessarily core hospital operations. So under that Memorial Health System, obviously the largest piece of that system is the hospital. So Memorial Healthcare is our hospital operations, inpatient, outpatient services, everything that you see within the 4 walls of the hospital. But along with that, in that new structure, it allows us to do things that you might not expect in a community hospital. For example, 2 years ago, we established our Memorial Child Care Academy.
Yeah, I heard about that.
A
lot of your colleagues are jealous, by the way. That's pretty innovative.
Over 200 kids in that.
It's incredible.
Child Care Center now, and 75% of them are Memorial Healthcare employees.
That's incredible.
Kids, and we did it because there was a need in the market. There was no one in the community that had the ability to stand something up with the scope and scale that was going to be achieve what our goals are. And it's a great recruitment tool for us to continue to engage our staff, to allow them to have the comfort of having their children a block down the road in a facility that is operated by their peers. And so our Memorial Health system allows us to do things
That's incredible.
like that. A couple of other unique things that we've done in that system structure is we recently acquired a Rite Aid building.
It's beautiful.
Yeah.
I saw the picture.
We're so happy for that facility.
It's beautiful.
In Owasso, with now has urgent care services 7 days a week, community pharmacy, which is
fully
attached
up
to it.
and running.
Fully up and running.
Yeah.
Again, the pharmacy is open every minute of the day that the urgent care is open. We're open 10 hours a day, 7 days a week in that facility. And our board just approved for us to do a second one.
Is that right?
Yeah, absolutely.
Good for you.
News coming soon about where and when.
Yeah,
but,
it's a beautiful building. I had a chance to see it on LinkedIn, commented even. You're doing some remarkable things. If you were to identify in the past year what you're most proud of, and there's so many, I know, but what would you characterize as like, this is it, this is what I worked on, this is what's been great for the organization?
Yeah, I really do believe that just the creation of this structure, both at the governance and at the operational level, is going to be a phase shift in the way we continue to be successful in an ever-challenging rural healthcare environment.
Absolutely.
The way that hospitals and healthcare systems in the past have operated is not going to be successful moving forward. So organizations need to be innovative. They need to think in new ways and create ways to remain to be successful moving forward.
That's right. So let's talk about some of the challenges. So we talked about all the successes. You got beautiful things that are happening in your community, but as a nation, we're at crisis mode in our healthcare industry right now. Obviously, the big, beautiful bill is going to have some significant consequences to rural hospitals and to independent systems. So I guess, how are you setting your organization up to deal with that challenge? And, what advice would you give the listener today, what they can do to advocate?
One of the biggest things that we've done is invest in our own advocacy efforts to bring awareness to this issue to the larger population. If you think about advocacy space in the healthcare system, there's advocacy at the tertiary quaternary care level. There's advocacy at the critical access level.
There is.
In that in-between level, in that community hospital level that doesn't fit that definition, there isn't a lot of advocacy work that's being done there. And so, a couple of years ago, we created that position within our organization to really show to our legislators, to our communities, how important these sources of funding are.
Absolutely.
For example, in my area of responsibility in hospital operations, two of our biggest areas are our family birthplace and our behavioral health unit.
That's right. Me too.
And absolutely. We're very similar in that way. And when you think about the cuts in the Medicaid space, the two in our area, in our facility, the two largest hit areas is going to be the family birthplace and the behavioral health unit.
And it's rural America. That's what you represent. And so you see this across the country. OBs will close. And psych units will close.
And you're already seeing it. You're already seeing
it
happening.
Central Indiana, northern Indiana.
It's happening Michigan.
It's happening in Michigan. Yes, it is.
And so,
Coldwater, Michigan, not too far from me, just closed their obstetrics unit.
Absolutely. And, there's areas of Michigan that this is happening, and the next closest hospital that has these services is 45 minutes away.
Or greater.
And if you think about those patients in that, the Medicaid patients that we have and the population that they have, try to convince them that traveling 45 minutes for preventative care is advantageous to them.
Well, it's not even good care, right?
It is not.
I mean, it's going to impede good care.
So use Memorial as an example. Yes, we're in the center of a triangle between three metropolitan areas of Flint, Lansing, and Saginaw, but for patients in our population, if our OB unit closed, the closest hospital to us is 30 minutes away.
Yeah.
And that patient population is typically challenged with transportation.
Oh, absolutely.
And so this is a big impact to the care of the patients in our community. Behavioral health services the same way.
It is.
As you do in your own community, we do a community health needs assessment, and behavioral health is always in the top three.
Yeah.
And those patients that need that critical care for those services won't have the capacity should some of these things get passed.
Absolutely. Tom, right? I mean, when you look at what we're facing right now across this country, you hit it spot on. And the reality of it is not only is it going to limit access for Medicaid patients, understand when we close a program, it limits access for everybody. Mm-hmm. It's not, you just don't hang a sign that says we're not taking Medicaid patients. It's everybody's impacted by it. Mm-hmm. And that is the danger of this legislation. So we hope that our community will lift their voice. So hopefully your community is lifting their voice. I know Absolutely. You are, but we have to continue to do that because this is very dangerous for our community and for our country.
Well, you've heard about healthcare deserts.
Yes.
The news when Rite Aid left the country, you heard about pharmacy deserts.
Sure did.
You're going to hear about obstetrics deserts.
Absolutely.
You're going to hear about behavioral health deserts.
You sure will.
A lack of care being able to be provided in the communities that these patients need it.
That's right. Need it the most. And we're also plagued, I'm sure your community is as well, with the lack of transportation. Mm-hmm. So, getting somewhere is going to be the other issue. Mm-hmm. You close down these centers, even if the hospital can prop up as an ER or whatever it is, but you expect individuals to drive longer distances. It's not going to happen, which means the quality of individuals' lives and their health care impacted significantly because of it.
And what you're going to find is that they just delay their care.
They do.
And so when they do come back to our doors through our ER, their acuity levels are higher.
That's right.
They're sicker.
Much sicker.
They're not managing their care. And really, the outcomes are incredibly, incredibly challenging for those patient populations.
Well, ladies and gentlemen, you heard it here from Tom Kurtz, president of Memorial Healthcare. It is so great to have you today in our podcast and really to talk about some of the challenges that you face, which is not any different and any more unique than what we hear across the country. But you're doing a great work in Michigan. I'm proud of the work that you're doing. Your hospital is making a lot of waves that are good and important, transforming a community, sustaining jobs. It's all great. So keep up the great work.
So first of all, thank you. And I would also echo those same statements for you and your facility.
Well, thank you.
You're doing a great job, and particularly with this podcast and getting the message out.
Thank you very much. It's great.
Thank you.
And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.